Dr. Matovu Badru, Chibuli Muslim Hospital. I'm a gynecologist and I'm an obstetrician at Chibuli Muslim Hospital. Today, we are here to remind ourselves about urinary tract infections, also called UTIs, versus vaginal infections. We have realized that actually people out there, women out there, confuse the two. They confuse urinary tract infections with vaginal infections. Why are we reminding ourselves today about the difference between these two? It's because treatment of urinary tract infections at times can worsen a vaginal problem. For example, vaginal conditions that present with itching, white discharge like milk that has gone bad are usually yeast infections. I'll call them fungal infections, candida. And these kind of infections are worsened by antibiotics people use to treat urinary tract infections. So someone come to you and tell you, doctor, my UTI is chronic, my UTI is not going away. When you ask them, so what have you been doing? I go to clinics, I go to the SAWs, they give me antibiotics. Then you ask them, exactly what do you mean by UTI? They tell you, my vagina itches. I get a discharge that itches. Then you realize that actually what they have been doing is just to worsen their disease. In other words, it is the doctor to tell the difference between a UTI or a vaginal infection. Your work is to tell the doctor the exact symptoms you are feeling. Because urinary tract infections present with urinary symptoms, such as difficulty in passing urine, frequency of passing urine, or actually painful passing of urine, something called dysuria. Yet vaginal infections, the discharges usually come from the vagina, which may change in smell, amount, or even color. So most of the time, it's better for you to tell the musao or the doctor or the health worker your exact symptoms than labeling yourself that, musao, I have a UTI. Musao, I think I have a UTI. No. Say your symptoms, the doctor will do the necessary investigations and give you a diagnosis, and you'll get treated appropriately. In that way, you'll get rid of vaginal infections, you'll get rid of UTIs forever, than staying there and saying, my vaginal infection is chronic or my UTI is actually chronic. Yet in actual sense, it is not being managed the proper way. Thank you.